Hi, I'm Jessica Teplicek. I'm one of the pediatric nurse practitioners here at Future Pediatrics. Today we're going to talk about the topic influenza, also commonly known as the flu. We're going to address what is the flu, who is at risk for the flu, how do we treat the flu, emergent signs and symptoms that need to be addressed, and lastly, how we treat it and most importantly, prevent it. What is the flu? The flu is a viral illness, highly contagious, spread by person to person, whether that be touch, sneezing, or coughing. Symptoms of the flu include often sudden onset of a high fever that lasts 2 to 5 days, cough, sore throat, body aches, headaches, and runny nose and congestion. Emergency signs and symptoms include shortness of breath, turning blue, dehydration, which includes signs such as decreased urine output, not producing tears when crying, or a dry mouth. Also, extreme irritability, where you're unable to console your child, or lethargy, unable to awaken them, feed them, to talk to them, or anything like that. These are all important signs. Lastly, if your child has a fever with a rash. These are emergent signs that show your child needs to be seen immediately. If it's after hours, the emergency room. If it's during hours, come straight to us here at Future Pediatrics. Who is at risk for the flu? Everyone is at risk for contracting the flu. The very young and the very old are high risk for secondary complications and serious illnesses resulting from the flu. Also, those with chronic lung diseases, such as asthma or cystic fibrosis. What is treatment for flu? The best treatment for the flu includes supportive care through fluid hydration and rest. You can also use Tylenol or Motrin for discomfort. Note that you need to be over 6 months of age to use Motrin. We also do not recommend any use of aspirin or over-the-counter medications for children less than 6 years of age. We also have the option, if your symptoms have been less than 48 hours, for an antiviral called Tamiflu. Tamiflu is often used for those who have very severe symptoms or the high-risk population that we discussed earlier. Not everyone needs Tamiflu, but if you do take it, it would be twice a day for 5 days. Antibiotics are not helpful for the flu unless you get a secondary infection, which could be pneumonia or an ear infection. That is why it's important after being diagnosed with the flu to follow up with your primary care provider within the first 3 days, or if your symptoms are worsening or your fevers are not resolving. How do we prevent the flu? The most effective way to prevent the flu is by getting your flu vaccine. Starting at 6 months of age, you're eligible to get the flu vaccine every year. If you're less than 7 and never had the flu vaccine before, you will get 2 4 weeks apart, but then it's only 1 time annually. Another effective way to prevent the flu is by hand washing, being very effective with your hand washing and staying home when sick. Lastly, if you have any questions or concerns, please come see us here at Future Pediatrics so you can get evaluated and we can give you the confidence and the comfort that you need.